I'm an emergency medicine physician at Northwestern University in Chicago. I'm also board certified in sports medicine and work in a bunch of different areas. I'm the medical director for the Bank of America Chicago Marathon, chief medical officer for United States Soccer. I'm a team physician with the Blackhawks. A lot of my area of expertise is in and around disaster management, large-scale events. That's where a lot of my research is. I also work with the Chicago Police Department and from an EMS side. And so really that background, fortunately or unfortunately, has probably positioned me in a way to hopefully have some skill sets to be able to manage, deal with an incident like COVID while we're still learning all of its effects on people, on communities. I'm obviously kept fairly busy in all of those areas. Yeah, without a doubt, Chicago is one of those cities like New York and like California and like the state of Washington that have been impacted fairly significant. Most recently, the county of Cook County was highlighted as the highest number of infections across the country. I think what's been different here in Chicago and the state of Illinois is that our trajectory of infections has gone a little bit slower than New York or California. So we've had time to build up resources, to be able to secure PPE, to understand the virus a little bit more. I could tell you about 6-7 weeks ago, there was a tremendous amount of anxiety within our emergency department and the hospitals because there was this fear that we were going to get inundated and overwhelmed and not be able to manage the cases based on what we were seeing in the state of New York and in and around New York City. That didn't happen. Don't get me wrong. We've been very, very busy. We've had highs of nearly 190 deaths a day in Chicago. Some of that is in our urban population. So I think different communities across the state of Illinois have been impacted differently. At Northwestern in our emergency department, what I'll share with you is, I've seen a lot of different things, and I've seen a lot of diseases. This one is unusual. You see people that are gasping for air, short of breath, that otherwise would not be dealing with this, and you're forced to make decisions that you didn't, necessarily make as frequently as you are now. Go slow. Is there's a lot of to be determined. Everyone feels like they have the answers, but I think that our information is still limited. This virus, we don't know what its midterm, long-term effects are on someone who tests COVID positive or someone who becomes symptomatic. So if you get sick, right now in the elite population, we're suggesting that they should get another electrocardiogram, potentially another echocardiogram, maybe pulmonary function tests. And the reason is because we don't know. We're seeing individuals develop hypercoagulopathy, meaning they get clots, strokes, pulmonary embolus, and we don't know why. So if the medical community is still trying to answer questions, the general public obviously should be very mindful of how they go back into society. There's part of our public that is not impacted by COVID or is minimally impacted by COVID. And so they feel that they're immune to this and they're going to go back to society the way they've always remembered it. The reality is we have to, in the next 12 to 18 months, is buy time to learn more about what this virus is and its impact on individuals of both genders, of all ages, and at the same time, be extremely responsible and mitigate as much as possible the risks of spreading it, getting it, et cetera. So my Georgisms are go slow. There's a lot to still be answered. Let's not get over our skis. Follow the guidelines of social distancing, wearing masks, being responsible for each other, and be prepared to be, flexible and shift as more information comes about. We want people to live. We want people to play sports. We want people to go out and about, but there has to be this responsibility that all of us have for each other and as well as for ourselves.